I live with diabetes. Sometimes it can be challenging to know how much insulin to take based on what you're eating or what you're going to do.
Everybody with diabetes deals with some type of fatigue, chronic depression, strain on the mental health. It never goes away. It's really critical to see an endocrinologist.
Diabetes is overwhelming and increasing worldwide, and endocrinologists are not. So we're faced with an immense overload of patients that are costly, and in fact, most of us struggle to break even.
Endocrinologists create a tremendous amount of value, yet they're among the lowest paid specialists in America. We see more retirements than new fellows entering into endocrinology, and we want to reverse that. We're doing that in two main ways. One is every Medicare beneficiary with diabetes is eligible for virtual care services. Less than 4% of Medicare beneficiaries with diabetes receive those services. That's a shame because it's better care for patients. It also is a shame because endocrinologists are leaving hundreds of thousands of dollars per doctor on the table in revenue they could generate. The second is moving endocrinologists into value-based care arrangements. And in value-based care, specialists capture more of the value they create. So for example, endocrinologists save Medicare about $3,500 per patient per year. In fee-for-service, they collect about $300 per patient per year. So they're creating great financial value for payers, insurance companies, but they're capturing very little of that. And we want to turn that around and help endocrinologists capture more of the value they create.
In addition to the plethora of data that diabetes technology and diabetes devices are now providing to doctors, we're aiming at integrating longitudinal care data from platforms such as the Trusted Exchange Framework, TEFCA, to essentially have a better view of who else is involved in the patient's care and how can that be better coordinated to optimize the outcomes. And in addition to that, we are also integrating social determinants of health data to also respond to social needs that the patient may have.
That's really important because as we reach out to those individuals, it makes it more natural. And so we will then, as the clinicians, will be supporting them in whatever is needed. Medical nutrition therapy, we're able to provide chronic care management, we are able to provide remote patient monitoring. Important piece as well is after working with those individuals, we're able to send a summary back to the practice so that we act as one team and we support that individual as one team.
We looked around for a virtual care provider who has experience treating people with diabetes. We couldn't find anyone who has as much experience with that population as Cecilia Health.
The Cecilia Health team is excited about the partnership with Valendo Health because Valendo's mission to provide endocrinologists the tools and support they need to grow their practice and shape the future of diabetes care is a nice complement to the operational and clinical support and strength of Cecilia Health. We see this as a unique opportunity. So the partnership will help practices working with the Valendo team to quickly increase their capacity and clinical ability to see more patients.
I chose to work with Valendo and Cecilia Health because they offered two very important things that I didn't have in my practice. First, Cecilia Health has a very highly developed way of reaching patients remotely, and Valendo is a group that has its database, and they can help me to monitor the outcomes of my patients. The two together, we can focus on the thing that we trained for, which is improving the health of patients with diabetes.
The response from the market has been really positive. Endocrinologists realize that they're being underpaid, and they realize that they are serving a really huge patient population. Patients are excited to have more treatment opportunities and to be able to get in to see their endocrinologists more quickly, and also to get care from CDCESs more easily. Endocrinologists are really excited to expand care, help more patients, and help people living with diabetes live better lives.
The approval of telemedicine and reimbursement over the last few years has been tremendous because it enables people to have their visit with their endocrinologist from the privacy of their home and really integrate their diabetes management within their regular life.
Our goal at Valendo is to improve the lives of people with diabetes by helping improve access to endocrinologists. And we want to do that by improving the way they run their businesses, the way they get paid, helping them capture more of the value they create through virtual care services and value-based care arrangements, make the lives of people with diabetes better, and make the lives of the endocrinologists who care for them better.